Hello, I'm Brad from TrueClot and Dislotech. We're now part of Integrated Medcraft. We were purchased earlier this year by one of our distributors. And I just want to show you our line of bleeding control training products and joint reduction training products. So we start with our kind of crawl level, non-bleeding dry trainers that are great for your stop the bleed type of training. So we have our PCT3 leg, so you can teach packing on wounds. You can also teach tourniquet placement, proper tourniquet placement. We have a knee to show you never place a tourniquet over a joint. It's directional, so we know which way is above the wound. And then we have these small wound packers here that are great just for tabletop to show people how to do the basics of wound packing. So we have lacerations and a small gunshot wound with a large cavity. So that's kind of starting people out on the basic level. Then we'll move to our kind of walk level where we have bleeding trainers that feature our TrueClot blood. And this is what's kind of started our journey in simulation is I developed a simulated blood for hemostatic gauze training. The military needed something to train on combat gauze and have blood that actually clotted and shows what happens when you use an advanced hemostatic. So it's a two-part process. The blood by itself will not clot, but if you add our clotting solution, you will get an instant simulated clot for moulage. You can also use this solution to treat gauze. So we treat our gauze. It's a simulation of quick clot combat gauze. And when you pack it into the wound, the gauze will actually activate the blood and you will start to see clots form within about 30 seconds. But the trainers are also designed to really teach people the proper way to pack, which is we're packing down towards the heart. There's a bone fragment on the inside. It's a very large cavity that requires proper packing. And if they don't, I'll show you here, if they don't get it properly packed, it's still going to keep bleeding. So this wound will hold 12 feet of our gauze. So it really teaches people to properly pack the wound. The other tabletop trainer we have here is our chest seal trainer. So that was designed to really show people on a basic level what happens with a chest seal injury or a chest injury, right? So when you have penetrating trauma, you get a lot of air mixed with the blood. So we simulate that bleeding. It doesn't bleed much, but it's important to clear that when you're applying your chest seal. So our wound trainer here will accept any real chest seal. So I'm going to use the Hyphen Mini here. And as you can see, this one's been used before. So one of the nice things with our trainer is when you put it on, you can hold it flat, really show people why you want to put a chest seal flat, because it will allow it to vent. But then when you let our bottle go, it will actually draw the seal back. So it's going to show that one-way valve action. And you can use a real seal. So whatever seal your team is using in the field, you can use that seal. You can also remove it and place it right back on the backer and use it again up to about 8 to 10 times so that you can not use one seal per person. You can get everybody used to using their seal. This trainer is also a wearable trainer. So it's got a Velcro pad on the back. The entire kit comes with a vest, 2 wounds. So there's an exit wound on the back, as well as a bag to hold a liter of blood and a small pump so that this will actually bleed while they're wearing it. So you can put it under clothing and have people applying the seal to a person wearing it. So they learn how to do it on the tabletop, then they learn how to do it while a person's wearing it. And then that brings me to our other 2 wearable trainers. So just like we had a tabletop wound packer, this is the wearable wound packer. So this fits in the inguinal space. It's same thing. It will pack up to 12 feet of gauze, a very deep wound, and it will actively bleed. But now, instead of learning to manage your equipment on the tabletop, you're learning to manage the patient, right? Because your equipment will never really change. It's always the same. It's the patient that changes every time. So that will help you learn to pack while someone's being belligerent or, rolling around, screaming. And our last wearable trainer is our tourniquet application trainer. So that is a wearable sleeve, goes on the left arm. It has a small moulage wound that will actively bleed just like an arterial, so it spurts right out. But there's padding on here, so if you're the person wearing it, when they apply the tourniquet at full force to stop that bleeding, it doesn't hurt your arm. So you can get many iterations with your tourniquet. It works with all windlass and ratcheting tourniquets. But it also, for instance, if you don't get this tight enough, it will keep bleeding. So you have to train people to put that on as tight as possible and train until the bleeding stops, is when you get your tourniquet on correctly. So that is our TrueClot line. It's available through many distributors internationally as well as in the US. And we sell everything individually. So if you need the blood, we sell that as a pre-made blood or as a concentrate. All the gauze comes in bulk packs, individual packs, whatever you need. And the clotting solution is available as a 500 milliliter squeeze bottle. And again, you can treat your own gauze with that, or you can use it to create moulage clots. So let's move on to our Dislotech product line. So that is our finger and shoulder reduction trainer line. So we have just a small finger reduction trainer that's great for classroom use, athletic trainers especially, so we can have our students looking at different types of dislocations. So our trainer will do 3 different positions, and then we can have them practice with a partner. So I can hold this, and the person can practice learning the correct way to reduce a finger. Again, it will do your dorsal, lateral, and volar dislocations. Let me get the volar dislocation here. So that will hold under there. Well, if I can get it. There we go. So same thing. Pull gently down, pull it up and around. Lateral and dorsal. So that can be held by a second user, really get that sort of like our wearable version. Someone can interact with a patient. And then we have our shoulder trainer here. So this will do an anterior dislocation, and it will do multiple different reduction techniques. So we can do the IMSH technique, modified IMSH, fairs, just traction, counter traction. So also a little counter traction here. So I can pull, and you'll feel it start to slip. And if we add a little bit of external rotation and just gently guide it in, it'll pop right back in. When it's in, it regains full range of motion. When it's out, you will get kind of a blocking. So it mimics what you would see with an anterior dislocation. Again, we can do a little bit of external rotation here. We can even kind of do a little bit of Fairs technique to wiggle back in, and your students will feel that pop back in. It will also do an anterior position. And again, we can try a bunch of different techniques for that. We can pull down. We can do just kind of a straight traction around, and when it goes back in, you'll feel it kind of pop. And again, they gain full rotation once it's done. You can also turn around on the stand to lay it down flat or prone, prone or supine, whichever works the best. So that is our full line of medical simulation. Thank you very much.